Ever wondered what makes multiple myeloma a unique type of cancer? Let's dive in. Multiple myeloma, a type of blood cancer, has a particular fondness for plasma cells. Now, plasma cells aren't the bad guys. They are the body's defense mechanism, producing antibodies to help fight off infections. But in multiple myeloma, these plasma cells go rogue, multiplying uncontrollably and crowding out the healthy cells in the bone marrow. This invasion often leaves telltale signs. Many people with multiple myeloma experience bone pain, particularly in the back or ribs. Fatigue is another common symptom, as the body struggles to keep up with the energy demands of the rapidly multiplying plasma cells. And with fewer healthy plasma cells available to produce antibodies, individuals with multiple myeloma become more susceptible to infections. Now here comes the interesting part, the hallmark feature of multiple myeloma, the Bence-Jones protein. Bence-Jones protein sounds like a secret agent's name, doesn't it? But what actually is it? Well, to unravel this mystery, let's dive into the microscopic world of our bodies. Bence-Jones proteins are, in fact, light chains of antibodies. Antibodies, our body's protective force against harmful invaders, are made up of two heavy chains and two light chains. These light chains, when functioning normally, play a critical role in our immune response. However, in the case of multiple myeloma, a type of bone marrow cancer, these light chains are produced in excess by the cancerous plasma cells. This excessive production leads to the formation of Bence-Jones proteins. Now you might be wondering, what's the big deal if there are extra light chains? Well, here's the catch. These proteins are not usually found in the blood or urine of healthy individuals. But in people with multiple myeloma, they are. These proteins are small enough to pass through the kidneys and can be detected in the urine, which is a significant clue in diagnosing multiple myeloma. But the story doesn't end there. These seemingly harmless proteins can pack quite a punch. The excessive Bence-Jones proteins can accumulate and form deposits in the kidneys, leading to kidney damage. This is a big deal because our kidneys are vital for filtering waste from our blood. If the kidneys can't do their job properly, it can lead to a ripple effect of other health problems. And it's not just the kidneys that are at risk. These proteins can also damage other organs and tissues, contributing to the wide range of clinical manifestations seen in multiple myeloma, from bone pain and fractures to anemia and infections. So, Bence-Jones proteins are not just some obscure scientific jargon, they are a critical piece of the puzzle in understanding multiple myeloma. They are not only the hallmark of this disease but also a key player in its clinical manifestations. So, if Bence-Jones proteins were secret agents, they'd definitely be the villains of the story. So, how does the presence of Bence-Jones proteins affect the patient clinically? Well, the symptoms of multiple myeloma often mirror the damage caused by these proteins. You see, Bence-Jones proteins are light chains of antibodies, and in excess they can cause significant harm to the body. Let's start with kidney damage. These proteins can overwhelm the kidneys, leading to renal insufficiency or even kidney failure. As the kidneys struggle to filter out these proteins, a person may experience fatigue, shortness of breath, or swelling in their legs, ankles, and feet. Next up, we have bone lesions. These proteins can stimulate cells that break down bone, leading to painful lesions or fractures. And frequently these bone issues can lead to another symptom, hypercalcemia. That's when there's too much calcium in the blood, which can cause constipation, confusion, and abnormal heart rhythms. These symptoms can be quite severe, but they are crucial in leading physicians to a diagnosis. With symptoms in hand, how do doctors confirm a diagnosis of multiple myeloma? Good question. Doctors often look for certain telltale signs in laboratory tests. One of these is elevated blood calcium levels. You see, multiple myeloma can cause bones to break down, releasing excess calcium into the bloodstream. Another common finding is anemia. With multiple myeloma, the cancerous cells crowd out healthy blood cells in the bone marrow, often leading to a drop in red blood cell count, which can result in anemia. And let's not forget the notorious Bence-Jones proteins. These light chains of antibodies are overproduced in multiple myeloma and can be found in the urine of patients. Detecting these proteins is a crucial piece of the diagnostic puzzle. Together, these findings, along with the clinical presentation, can lead doctors to a diagnosis of multiple myeloma. Multiple myeloma is a complex disease, but understanding its unique features like Bence-Jones proteins can help demystify it. Remember, knowledge is power in the fight against cancer.